Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Pap smear. Introduction.
During a pap smear, cells are taken from your cervix. The cervix is the boundary between your uterus and vagina. A pap smear helps healthcare providers find cervical cancer in women. Finding cancer cells in the cervix early with a pap smear makes treatment easier in most cases. A pap smear can also find cells that could turn into cancer.
This program explains pap smears. It covers the benefits of the test and what you can expect the procedure to be like. Anatomy. The female reproductive organs include the vagina, the uterus, the fallopian tubes, the ovaries. The female reproductive organs are located in the pelvis between the urinary bladder and the rectum. The ovaries have two main functions. 1. The production of specialized hormones such as estrogen and progesterone. 2. Ovulation, which is the release of eggs needed for reproduction. Estrogen and progesterone prepare the inner lining of the uterus in case a pregnancy takes place. These hormones also regulate when the eggs are released. When an egg is released, it goes down the fallopian tube where it may or may not be fertilized by a sperm. If it is not fertilized, the egg and the inner lining of the uterus are discharged to the outside of the body. This is known as the menstrual period. The uterus is pear-shaped and measures approximately 3 inches in length. The lowest part of the uterus is called the cervix. It is a narrow passage that opens into the vagina. The vagina opens to the outside of the body between the urethra, which is the urinary bladder opening, and the rectum. Cervical cancer.
Cervical cancer may be caused by a virus called HPV. The virus spreads through sexual contact. Most women's bodies are able to fight HPV infection, but sometimes the virus leads to cancer.
Cervical cancer usually develops gradually over several years. At first, the cells that line the cervix become slightly abnormal. This is known as atypia. Finding and treating these changes can help prevent the development of cancer in many cases. Atypia could develop into cancer without treatment. Cancer is limited to just the surface area of the cervix during the early stages of cervical cancer. This is called carcinoma in situ. Cancer will move deeper into the cervix without treatment. From there, it could spread to other organs.
Finding cancer cells in the cervix early makes treatment easier in most cases.
By getting regular pap tests and pelvic exams, you can find and treat any problems before they turn into cancer. The Pap Smear, or Pap test, is named after the healthcare provider who made it popular, Dr. Papanicolaou.
The goal of a pap smear is to take a sample of cells from the cervix using a swab or smear. The cells are sent to a lab to see if they are normal.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
During a pap smear.
Do not have sex, douche, or use any products on your vagina for 2 days before a pap smear. These can make it harder for the healthcare provider to find cancer. A pap smear takes only a few minutes. You will be asked to undress and given either a gown or a sheet to drape over your lap. You will then be asked to lie on an examination table. Your knees will be bent. Your feet will be placed in stirrups. The healthcare provider will then gently open your vagina and insert a speculum. A speculum is a tool used to keep the vagina open so that your healthcare provider can see your cervix clearly. You may feel some pressure or discomfort when the speculum is inserted.
This is usually not painful. A small swab is then inserted into your vagina and used to take cells from your cervix. This may cause some discomfort followed by minor cramping for a few hours. The sample, which contains cells and mucus, is then smeared onto a glass slide and sent to a lab for analysis. The cells will be examined under a microscope. After the test is finished, the speculum is taken out. Ask your healthcare provider about when you can expect the results of your Pap smear. You can then go about your daily activities as usual. Results. A specialized healthcare provider known as a pathologist will examine your Pap smear sample under a microscope. They will be able to find out if there is infection, atypia, or cancer in the specimen. The test results will be sent to your healthcare provider. He or she will discuss the results with you. If the test comes back negative, that means your cells are normal. No further tests or treatments are needed. If the test comes back positive, that means some of the cells look abnormal. This does not necessarily mean you have cervical cancer. You may have an infection or another problem that needs treatment. Your healthcare provider may perform additional tests to find out more. Prevention. A Pap smear test is one of the best ways to detect cervical cancer in its early stages. The chances of successfully treating cervical cancer are higher if it is found early. There are several different recommendations for screening. Talk to your healthcare provider about what is best for you. Talk with your healthcare provider about when to begin getting Pap smears. They should usually start before a woman turns 21. Your healthcare provider will tell you how often you need them. Regular Pap smears and pelvic exams can help lower your risk of cervical cancer. You can also lower your risk if you use condoms during heterosexual sex. Avoid smoking. Get vaccinated against HPV.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Cervical cancer may be caused by a virus called HPV. The virus spreads through sexual contact. Most women's bodies are able to fight HPV infection, but sometimes the virus leads to cancer. A Pap smear test is one of the best ways to detect cervical cancer in its early stages. The chances of successfully treating cervical cancer are higher if it is found early. A Pap smear takes only a few minutes. You may feel some pressure or discomfort when the speculum is inserted. This is usually not painful. If the test comes back negative, that means your cells are normal. No further tests or treatments are needed. If the test comes back positive, that means some of the cells look abnormal. This does not necessarily mean you have cervical cancer. You may have an infection or another problem that needs treatment. Your healthcare provider may perform additional tests to find out more. Talk with your healthcare provider about when to begin getting Pap smears. They should usually start before a woman turns 21. Your healthcare provider will tell you how often you need them. Thank you for using Explain.